My name is Megan, and I'm going to be your student nurse today. I'm going to give you a quick lesson on citalopram. Everyone gets sad. It's normal to feel a little blue on rainy days, and for most people, it's short-lasting, only a couple of hours until the sun comes back out. For some people, those sad moments start dragging on to days, to months, to even years, and this can cause the individual to lose interest in life, feel like they have no energy. They can start getting too much or too little sleep, and waking up just as tired. This cycle can cause some people to eat their feelings or lose their appetite altogether. For those that are depressed, they live in a gray world of despair, helplessness, and guilt. Symptoms need to last at least 2 weeks to be considered clinical depression. Emotions happen when different parts of your brain communicate. To communicate, your brain uses chemical messengers released by the branches of neurons in your brain. Some chemical messengers create an energetic response. Some keep you steady, and some make you feel really good. Although the exact cause of depression is still unknown, it has been connected with abnormally low levels of these chemical messengers in the emotional part of your brain. Citalopram is an antidepressant that is part of the SSRI group. SSRIs work by affecting the chemical messenger responsible for keeping your emotions steady, and is important for proper sleep, pain, and emotional regulation. Having too little serotonin can lead to depression. SSRIs increase the amount of serotonin that is released when their branches meet. They also work by making the receiving branch more sensitive and the giving branch less sensitive, increasing the odds that their serotonin keeps moving forward and does not get taken back up by the giving branch. Citalopram is a commonly used SSRI for the treatment of depression symptoms. For most, it boosts their energy and helps them get to all those tasks they've been neglecting. Because it gives energy, take citalopram in the morning. It is not unusual for the first week to feel like you can conquer the world and to have a hard time getting to sleep. This effect typically fades. The dose is at its peak around 4 hours after taking the first dose, and the effects can linger 1 to 2 days. Everyone's brain chemistry is different, and for some, citalopram can make their depression so much worse, and especially in young adults and teens, the risk of suicide can increase. Nurses and caregivers should be aware and keep an eye out for unusual changes in behavior. Although SSRIs are considered some of the safest antidepressants, there are still quite a few side effects. Mild side effects are increased yawning, sweating, agitation, feeling irritable, fatigue, prickling feeling that covers your skin or scalp, forgetfulness, sinus infections, dry mouth, tummy trouble, loss or increase in appetite. Food starts to taste a little different. You might notice extra drooling, some gas, increasingly painful periods or lack of periods. Of course, if you're female, frequently having to pee. More severe or troublesome side effects could be fever, abnormally fast heartbeat, feeling dizzy when you stand up too fast, unusually low blood pressure, inability to focus eyes, so vision issues. 70% of patients report a loss in libido for both men and women, which can be failure to orgasm for females, inability to get an erection or ejaculate in males. Loss of desire is the primary cause of people to stop taking their medications. Another primary reason they do not want to continue because of the weight gain. Care providers should talk to patients and assess if the side effects outweigh the benefits. Citalopram is a caution during pregnancy. SSRIs have been shown to increase the risk of the baby having complications at birth, requiring feeding tubes and respiratory support. Discontinue citalopram if breastfeeding because it does show up in milk. Nurses should continually monitor for adverse side effects and possible suicidal ideations. Limiting the number of refills can negate abuse. Citalopram is not for children. Women of childbearing age should be on contraceptives and should report any possible pregnancies. If needing to use the antibiotic Linezolid or methylene blue for oxygen problems, do not use those medications within 24 hours of taking citalopram, or vice versa. Citalopram react with some over-the-counter drugs. Consult a pharmacist or healthcare provider before taking any other over-the-counter drugs to see if they're compatible. Serotonin syndrome is a complication where there's too much serotonin in the body, commonly called SCS. SCS is life-threatening. Client teaching is essential to prevent or catch SCS soon. Symptoms can start as early as 2 hours after taking a dose, or it can begin as late as 2 weeks after starting the SSRI. Signs and symptoms of SCS are unexplained confusion, anxiety, restlessness, seeing things that aren't there, high blood pressure, tremors, sweating, high fever, suddenly losing coordination, muscle wasting. Avoid using other antidepressants and Demerol and herbal substances such as St. John's wort and ginseng during SSRI use. The nurse should thoroughly assess for recreational drug use as well, such as ecstasy or cocaine, which can lead to SES as well. Instruct clients if they miss a dose to wait until the next morning to take the next. Taking 2 doses too close together can increase the chances of SES. The client should be warned not to abruptly stop taking the citalopram to avoid SSRI discontinuation syndrome, prevents withdrawal. Lower mood, dizziness, weak and tired, tingling in the skin, nausea, intense dreams, irritability, brain zaps, and confusions can be felt. Symptoms can disappear within 24 hours of restarting the medication.